Hot flashes aren't the only signs of menopause. I know it's been 5 months that I haven't continued my Menopause Awakening series. I haven't added anything. Not that I didn't have anything to add. It's more like life's been lifing. I started a new job. I recently also moved. Um, my youngest, 18 years old, he just graduated from high school. And I've been processing and I've been living at the same time. I've been present and I'm back. I want to talk to you today about hot flashes and not hot flashes, excuse me. I want to talk to you today about um, menopause and that it doesn't equal hot flashes. That's what I meant to say. Menopause doesn't equal hot flashes. Um, a lot of women think that because they haven't experienced any hot flashes, they're not in menopause. And also, a lot of women experience hot flashes and only hot flashes. And some people experience hot flashes amongst other things, and they don't know that the other things are part of menopause. But this is why you have me, because I am so obsessed with learning the material, not only for myself, but also to teach others, because it's very important that we take accountability and responsibility for our own health. And as women, we've been treated like little men, and we've been left out of research. Research is only made for on men and for men and about men, and the medical community also is very focused on fertility when it comes to women, and they're very focused on infertility, fertility, and what's the other part of medicine that they love with women? Oh, giving birth. But when it comes to the science, the biochemical things of women, most people, especially doctors and anyone in the healthcare system, they're not aware because women didn't live after 40, 50 years old, right? Like way back in whenever, I don't know when, um, women were not, women and men, we were not living as long as we're living now, right? Science has allowed us to live beyond the 50. If you can remember a 50-year-old back then, um, didn't look, act, or was treated as me, right? And I'm 50 years old. Um, and it doesn't mean that because you're 50 that you're in menopause. No, most likely you're in perimenopause. You could be in perimenopause, you could be in menopause, and you could be in postmenopausal. Um, how do you know that you are in menopause? Because you have 1 year that you don't get your period. And don't let anyone tell you that any blood test is going to determine if you are in perimenopause or menopause, because if you don't have the levels before, your estrogen levels before all of this, what do you have to compare it to? And estrogen levels can vary so much on a monthly basis, even on a weekly basis, on any woman, because it all depends on your cycle. That's why we're not easy to study, because we have a cycle. Anyway, I digress. I'm going back to my little cards because ADD, baby. Anyway, for those of you that don't know me, I am Sandy. I'm your favorite nurse. I've been a nurse for over 20 years. I keep count of how many years I have because since I remember, I've been in school um, since I was pregnant with my son, and my son is 27. So I went to school. I was a CNA, then I became an LPN, and then I became a registered nurse. And when I became a registered nurse, I had my daughter, and that's how I know how I had my daughter in 2003, and I graduated that same year in 2003. Um, she was born in January. I graduated in December and she was born in January. And that's how I know how many years I have being a nurse because everything else has been a blur. Um, I am a menopause coach. And like I said before, the reason why I decided to do that, to dive into that area of, of, of health, is because I'm doing the research. I'm doing the research so that you don't have to. Um, anyway, I've been sharing my menopause awakening with you, and it's been about 5 months. And because of life and work, here I am. This channel has been like solely for this series because I feel that even my nursing colleagues and family members and sisters and just women will all benefit from this. So the reason why I say that in menopause, hot flashes are not the only signs it doesn't equal menopause, just hot flashes, because there's this other um, little monster type of pest that is a sign also of menopause. And I am going to struggle with the pronunciation of it, but you can look it up and you can pronounce it. Okay. So it's I want to talk to you today about GSM. GSM, GSM stands for genitular gen, geniturinary what? Geniturinary genitular genitular blah. Okay, that syndrome of menopause. So, in other words, I'm gonna break it down because by looking at the word, I know what it means. Jenny, Geni, in Latin, covers the January, like the urinary area, like your bladder, your vagina, right? Okay, so the syndrome of menopause. These are symptoms like a collection of vagina and sexual and urinary symptoms caused by dropping of estrogen levels during perimenopause and menopause. In other words, these are symptoms. It's a collection of symptoms that happen during menopause, and postmenopause, but mainly peri and menopause. These symptoms happen because of the drop in estrogen. And so, what happens is that the tissues of your vagina and your bladder and your urethra becomes thinner. And because it becomes thinner, it becomes drier. And because it becomes drier, it becomes more fragile. The walls of your vagina are like the inside of your mouth, like this, and it's thick and it's moist. You see that? And just like that, just your oral mucosa and your vagina mucosa also gets dry because of the drop of estrogen. That's why you see a lot of women that will complain of dry eyes, um, dry mouth, and dry vagina. And most of the times there's shame around it because the women that I've spoken to, a lot of them are ashamed even to admit that they are in menopause, as if aging and being alive is bad. Okay, what's the opposite of not of menopause of 50 or what? It's like not being here. So do you want to be here or it's like it's weird. Anyway, that's capitalism for you, but that's not what we're talking about. And what is it called? The feminist and the feminist in me. What we're talking about is again, the tissues become thinner in your vagina and drier and more fragile. Some women experience tears during sex, during penetration, tears in their vagina because of this. Um, because of those things, it alters the healthy um, balance of bacteria in your vagina. There's a couple of bacteria that you have in your vagina and also yeast that are good for you. And they are in balance with each other. They fight off microorganisms and bacteria. And when you have more than the other, like when you're younger and you have more yeast and less bacteria, you get a yeast infection. But in this case, because of the loss of estrogen and the imbalance, a lot of the times it throws off the balance, and you are more susceptible for an infection, which is called morphobacteria, which causes a UTI. And so GSM are is the symptoms like frequent UTIs, frequency, and urgency. And for me, it came a point like maybe 3 years ago, I can say that I will be in my car and I will use the bathroom before I leave the house, get in my car and go to point B. And once I get there, I had to like move everyone out of the way and go use the bathroom. If I didn't use the bathroom, it used to feel like I was going to not only urinate on myself, but it used to feel like I was going to lose some part of my body from inside out. Like it was insane. I couldn't hold it. Um, that was annoying because I was able to go before this to the mall or anywhere and just be okay. And now I was this person, the person that as soon as I got somewhere, I had to pee, even into other people's homes. And anyway, so that back to the symptoms. Um, the drop of estrogen causes vaginal dryness, burning, itching, pain, discomfort during sex. I think I mentioned that. And sudden urgent need to urinate or needing to urinate more frequently. And a lot of the times, also leakage, a little bit comes out. Some people say without even doing anything, it's just that you needed to go pee, and instead of like the reflex holding it, like it just comes out, which is called urinary incontinence. Okay, so with that being said, I just want you to know that there is help. Um, I've been on estradiol, vaginal cream, um, for about 6 months now, 6 or 7 months, and it has helped a lot. I don't have the frequency or the urgency, which was most of my issues. And what happens with the reason why it happens to you or to me, why it happened to me was because vaginal atrophy. What happens is that your estrogen levels go down. So everything, because it becomes dry and sometimes it's not even visible. um, when I say dry, it doesn't mean that you no longer have moisture or that you don't lubricate when you are in the act or before the act or whatever. It's more like is not enough inside to help you prevent atrophy, which means things start pulling, okay? And because it starts pulling, and because where is it? I wrote it here somewhere. And because the tissues are not being supported with collagen because of the lack of estrogen, and also the tissues are thinner, what happens is that your bladder is there's nothing encasing it any not nothing, but there's a lot of it is gone, and it becomes your bladder sticks to the other organs, and or it descends, it comes down onto your pelvic floor, and sitting on that, that makes the pressure and you want to pee, right? That's one. Two, that's how you know that you are going through atrophy before even the lack of moisture comes, the lack of lubrication comes. So if you catch this, you can reverse atrophy. Okay, you can reverse atrophy and have your vagina health at optimum level. Okay, with that being said, the replacement for estrogen is called estradiol vagina cream, and it's so minimal exposure to. It's like the minimal dosage, and the good thing about the walls of your vagina is that it doesn't go anywhere else in your body. It just stays there. That's one, and wherever you put it, that's where it works. Um, Another thing is that the dosage is so low in estrogen that there is no possibility of you having any side effects or negative side effects. That's the other. And another thing about estradiol vaginal cream is that it's cheap, and that I feel, that's just my personal opinion. Every woman after a certain age, around your 30s, like 35 and up, when you're in perimenopause, which is around that age, or if you don't have your ovaries or if you don't have your uterus, you are in menopause. Um, you should use the cream, period. If you're not using it, then I don't know what to tell you. Um, this is so you have your vaginal health and your sexual health on point, because it also helps with, well, it helped me with I didn't have an issue with orgasms. It was more like this orgasm is different. This orgasm is more grounding, and it's kind of like long. It's not strong, like the end of the world, pleasure, crazy, ecstasy, whatever. It's more like it's a feeling, it's a climax, and it stays like um nice and steady, and then it goes away. It doesn't go crazy and down over, you know, women understand. Anyway, which I like this too a lot. And let's get into it. I want to show you what I do and what I learned with the estradiol vagina cream. Okay, this is what the tube looks like. It lasts a long time. It lasts at least for. This is my first tube, so, or is this, or my second? Maybe my one and a half. Who knows? But this isn't. I haven't bought it. No, yeah, one time. So it's been 6 months. This is the tube, 6 to 7 months, and it lasts a long time, and it should last even longer sometimes, because I am gonna show you what I do with the extra, whatever leftover I have, where I put it in my around my eyes, because estradiol is the hormone of youth. So why not use it to our advantage? So this is covered by your insurance. And if it isn't, you shouldn't have to pay more than $60, 60 to $100 in these companies. However, in the pharmacy is way cheaper. It's like $30. And to for me, it cost me $18. And I have insurance, so I guess the co-payment was $18. The last time I got it, it was with my insurance, and at the time I had another one and it was free. So don't pay more than $100 for your estradiol. When you ask your doctor for it, you let them know that it's for GSM, genitourinary syndrome of menopause. Look it up. I don't know how to pronounce it. Anyway, which is frequency, urgency, frequent UTIs. If you have urinary tract infections back to back, especially during perimenopause, you turn 40 and you have a UTI, and then a month later, 2 months, or less than a month later, you're having sex and you have another UTI. 2 weeks later, you have another UTI. It is not your partner, it is not you, it's the lack of estrogen, and also is your doctor that doesn't even like catch you like enough to know, like, dude, put her on estradiol. So this is where you come in. The estradiol cream, I'm gonna show you. It's my new one. Comes with a tube. Oh, can't open it. Anyway, throw it out. Garbage. This is your tube, right? What you're gonna do, you can do one or two things. You could take your finger, and you see this little the mark right here. You could put estradiol cream. I'll show you. That's my dog, my crazy dog. Okay. At night, not that I haven't used a little bit in the daytime, which I have, because I pay my own shit. No, but in at night, because you're sleeping and it stays there because of gravity, and then in the morning it's all gone, right? And you don't. Excuse me. Anyway, so you take that, or you can take your tube, fill it up, and then what you do is that you take it out and put it on your finger and see how much is 1 gram, because this is 1 gram. 1 gram. This is 1 gram. So you take 1 gram and, excuse me, this is when you know it's real. And I don't have a production company and a whole bunch of stuff. So you take your finger and you insert it up north, right? Your vagina. You go around the inside of your vagina, right? Come out. And when you come out, go outside of your vagina and put it around your labia, right? And a little bit, whatever left over, because you're going to have leftover, you put it around your anus or your rectum, and not all around it, but just like close enough, because it actually prevents colon cancer. And then um, go up north. Don't do the anus first. Let's rewind this because that was bad. Vagina, right? Come out, go up the hood, the clitoris hood around there, the urethra, put some there, then whatever left over, go almost around, your perianal. That's like between your vagina and your anus, or around your anus, your rectum, if you have enough, right? And whatever left over, it's okay, is yours, okay? and you know you're not dirty, so it's fine. Whatever left over, do not throw it out. Do not throw it out. Take it, either mix it. Let me put it. This is my daytime one. Okay. Either mix it with your cream, your eye cream, a little bit, just a little bit, because you're going to have a little bit left over. And you put it around, right, your eyes, not inside your eyes, but around that area because it prevents you from having wrinkles. And then you could put some here if you want. And then you don't have to use Botox anymore. Okay, do that. And what you're going to do, you're going to do that because they don't tell you this part. This is the trick. You're going to do that the first time you use it for 12 to 14 days, depending on your symptoms, how severe they are, right? So be patient. Be patient. I promise you, by the fifth or seventh day, you will know and see the difference. But complete the treatment. Go for your 12 to 14 days. When you finish that every single night for 12 to 14 days, you finish that treatment. Then what you're gonna do, okay, is you're gonna take your estradiol and you're not going to use a whole pulgada. You're not gonna use that, a whole gram. You're gonna use half a gram this time. So you're gonna take, remember the first time was here, right? Now you're gonna take half of that. This is why it lasts a long time. So you're gonna take half of that. And what you're gonna do, depending on your severity of your issues, and to maintain and to keep it up forever, bitch, forever. It's okay. It's not that serious. It's like insulin. It's like vitamins. It's like a lot of other things that you do every single day. It's like smoking. It's like drinking. You drink every day until you die. So it's okay. Anyway, you take half of this and you do the same thing, but instead of doing it every day, you could do it 3 times a week, 3 times or 2 times a week. For me, what's been working has been 2 times a week. I do this 2 times because I want to remember and how I remember to do it is by every time I change my patch, I know that I also have to put my cream on. You develop your own system. Um, and I'm only like doing this because this is the tube that I'm not using. I don't play with this. This is like gold for me. Because I love it, and I put some on my hand too. Um, just so that way they don't get dry and they don't get thinned out, and that's how you see people's hands changing. There is not plump anymore because then they're not producing collagen and or estrogen, and estrogen helps with the production of collagen. Okay, so you do that, and that's indefinitely if you feel like it, or you do it and you don't do it and you just do it when you do have symptoms. But I feel like preventing is a good thing. Not only preventing but also maintaining your vagina health is a great thing. um and speaking of patches, just because I'm just gonna bring this up, um fear is not your friend. Fear is not your friend. Remember, estrogen is a hormone, just like vitamin D. Vitamin D is a hormone. And when you are deficient in vitamin D, what do? You take vitamin D, right? Okay. So look it up. Estrogen is a hormone and is a hormone that you have in your body since the moment that you were decided by the forces of nature or whoever and whatever that you are a woman and that you are a human, right? You have estrogen. Don't be afraid of estrogen. Be afraid of the illnesses that you will be acquiring because of the lack of estrogen. Okay, the the diseases, the three main diseases that estrogen prevents you from having is heart disease. Number one killer is not breast cancer, it is heart disease. Google it. Use ChatGPT for this. Anyway, um, estrogen prevents heart disease, prevents Alzheimer's, and prevents osteoporosis. Those are the three main killers of women, anyway. Um, Osteoporosis will eventually kill you, long and slow death, because usually they suffer people suffer a fracture and then a hip fracture, and then they're in the hospital, you're in the ICU. Nobody's gonna put estradiol cream in your vagina, none of that shit, because nobody cares about you. You're a woman, nobody cares. And people think that when you're using that, it has to do with sex. And God forbid a woman is thinking about sex. People always find that very shameful and very ick, very ick. So they won't allow you to put estrogen cream on your mother if she's in the ICU, just so you know. Anyway, so you're in the ICU, you suffered a hip fracture, and from there on, your life is shit. You're gonna be in a wheelchair, then your dementia progresses, and then it's fucking long. You're in a nursing home forever, hospice, and that's it. If you want to be a burden to your family, then you go ahead, ignore this video, and go ahead, take your vitamins, take your vitamin D, and take your tea, and pretend all is well. Don't say that I didn't tell you so. Anyway, don't be afraid of estrogen. Anybody and a lot of people, and most people, can be on estrogen. When women tell me I can't because of my family history or cancer or this and that and the other, I don't say anything, because everyone is free to make choices and also to read. The information is out there. And when I'm telling you, there are so many forms of estrogen that you could be on. It could be pill, it could be injections, it could be spray, it can be rings, vagina rings, it could be patches. Like I said, there's a lot of way of taking estrogen. Anyway, my estrogen patch, and they come depending on the company or the brand. There's like three or four brands. Um, the sizes vary, and so do the dosages too. There's different levels depending on your symptoms and how you're doing with the symptoms, right? Because when I got on mine, my provider had to change it twice. Was it? She adjusted it once or twice. No, she adjusted the estrogen level. She increased it because I was having breakthrough bleeding, and then she increased it, and then I was sleeping, but I was still getting up like around 3 or 4 o'clock in the morning, and not being able to sleep again. Sleepless sleep. That's what that's called, and it sucks, right? So because of that, she increased my progesterone level. Okay, so I'm on progesterone, and the progesterone is because I have a uterus, and anybody that has a uterus should be on progesterone to protect the lining of the uterus if you want estrogen. If you don't have a uterus, you don't have to be on estrogen. It's fine. You don't have to protect your uterus because you don't have one, and that's fine. You don't have to use progesterone. Will it kill you if you're on progesterone? No. Can you take it even if you don't have a uterus to protect? Yes, because progesterone is also a hormone, and progesterone is the fertility hormone. The only time you have a lot of this is when you're pregnant. So with that being said, when I take this, I take two instead of just one because I sleep. I don't have a problem falling asleep. My problem is staying asleep. So I sleep and I wake up fine. And it's not like Benadryl. It's not like you're taking anything, any sleep aid. It's not, you're not going to feel groggy or anything. You're just going to sleep. You're going to have dreams and you're going to be fine. Wake up normalito. Okay. And it's awesome. Okay. So, anyway, progesterone. That's why it was adjusted for me. And then my patch. The patch is, I'm looking for a quarter. Okay, a quarter is a little bit bigger. This one, the Dottie. There's another one, and the other one, I forgot the name of it. I have it somewhere around there. The dosage is smaller. Um, that one, the patches looks bigger. Actually, the dosage is the same, and it actually, that one is called combi patch. That one has progesterone and estrogen together instead of taking the pill, and it was just in the patch. However, for me, what works is the pill because I take two of those, and that's 100 milligrams. Anyway, and they're 100 milligrams each, the progesterone. The good thing about the progesterone pill is that if the side effect for you is too much, which is, it could be two. For me, it was just one. I don't get nauseous. Um, that could be a side effect to get nauseous. That's why they tell you take it at night. One, and two, because it does get you sleepy. For me, it was like, because some people get extremely sleepy, extra. That was me because I've never had an issue with falling asleep. So taking this has taken me to the next level. I just fall asleep on like this, like a, it's like on command. I go to sleep, I stay sleeping. So the good thing about these little pills is that they come, my hands are clean, in capsules. And these little capsules, you could Google it. I'm not lying. You could insert it up yours, up your vagina. And because if the side effects, if you're nauseous and you don't like that, who likes that? Nobody, right? You could either take a B12 to prevent it. Anyways, everyone should be on B12 regardless. B12 to prevent nausea, or you put it up your vagina and the capsules melt and you will get you won't get sleepy like crazy. You just be regular snoozy. You go to sleep and you stay asleep because it still works, and you protect, no, I'm lying, you will sleep regular fine because it doesn't go up there, it just stays in your vagina area, but it protects your uterus. And if you're using progesterone just to protect the lining of your uterus, then you could put it up there. But if to prevent cancer. Anyway, but if that's not the reason why you're using your progesterone, if you're using it because you want to sleep, then you should take the pill. That's that. Yes, about B12. I am on women's vitamin, right? I take a D3 in spray form with K. It comes together because so it can bind. Because a lot of the times we take medicine, not medicine, we take vitamins, and you don't know how it really works and whether it's binding and whether it's staying in your body. And as you know, I'm also a hydration nurse. So I'm always going to tell you that vitamin B12, vitamin C, glutathione, and what's the other one I carry? Yeah, that's basically it. Those are vitamins that are essential. Those are vitamins that you will get 100% in your bloodstream. And those are things that you do in addition to, right? I'm not going to tell you do the vitamins, everything is going to be okay, because it's going to mask it. You're going to feel great maybe that week. Um, or maybe placebo effect, right? For a while, but it all comes back. And you shouldn't have to be a 50-year-old vibrant woman full of life and going to work and whatever you do and having incontinence. You shouldn't have to use those diapers that they sell for women. I don't even know why it's there. You shouldn't even have to. You shouldn't even have to when you don't really, there's it's unnecessary. Okay? Anyway, remember, throw your tube out, use your estradiol, use your estradiol. Don't wash your hands. Take care of it, put it all over. Put it on your face and on your hands. And um, call your doctor, get on something, prevent the three major diseases that are was affecting women our age. Okay, and see you next time. I hope I was helpful.